Hey, what's up, everyone? It's Dr. Glenn Vo, and I am super excited to have Dr. V here, who is one of the founders of Aerosol Assist. Now, here's the thing: we've been talking about Aerosol Assist, and we've been talking about Aerosol Assist because what's going on with the pandemic and whatnot. We're trying to keep things really safe right now. Here's the thing: in dentistry, we are really good about practicing universal precautions and being safe. But, times are different now and we have to take it up a notch, right? So with further ado, let me introduce you guys to Dr. V here. Dr. V, do me a favor and just kind of introduce yourself, talk about your background in dentistry, how long you've been practicing, about your practice, and why you got involved in Aerosol Assist.
All right. Well, thank you very much for having me. My name is Vigarni Arguello. Everyone calls me Dr. V because it's much easier to pronounce than Vigarni. So feel free to call me Dr. V or V, anything's fine. I got my degree in 2009 from Boston University. I've been practicing since pretty much that time. And the entire time, I love dentistry. I've been working on it since day one. I have two practices in South Florida. And because I was working on it so much, I would realize, after 6 days a week, 9 to 5, that specifically on Fridays, my throat would get itchy. So that's exactly when I started to develop the Aerosol Assist with my best friend, Warner Blumenthal. He's a biomedical engineer that helped me do this. So a while ago, really, even before the pandemic, we started developing the Aerosol Assist to tackle that problem that, again, I would go ahead and start to feel sick during the weekends. And eventually, because of the pandemic, we both had a lot of time in our hands to go ahead and finish developing that product. Before the pandemic, I would get really busy. He'd get really busy as well. So we had this product, lying on the back, and we knew that it was important, but the pandemic just showed us, no, this has to be done, and it has to be done as soon as possible, because there was one point that literally, I just remember having a bad dream, crap, I got to go into work. What am I going to go ahead and do? Literally, the device that is going to go ahead and help me is sitting there doing nothing. So he started coming over every single week, and then we just started developing it. He has a 3D printer, so that made things easier. We just got my idea, modified it, saw if it worked, kept changing it over and over until we had many iterations, and we finally got the final product, the Aerosol Assist, which is fantastic. And the good thing is that because we've deployed every single procedure to have some form of aerosol control, that itch that I used to get in the back of my throat is no longer there anymore. And I really hope that I could help a lot of clinicians experience that same relief. And knowing that in the same way, a lot of people, you look at old lectures and you see people doing dentistry without any gloves. That's the weirdest thing in the world. I hopefully in the future that you'll see dentists, working on people and they're not using aerosol protection. You'll be like, what were they thinking?
Well, Dr. V, I'm going to say this, and I'll tell you, just to let you guys know, I got introduced to Dr. V and his partner because I was at a conference. I was speaking at a conference, and my hygienist was just walking through the exhibit hall, and Aerosol Assist caught her eye. She went over there and she started talking, and she came up to me and said, Dr. Vo, you need to order one of these. I was like, okay, fine, I'll order one of these. Because the thing is that have you guys, most of you guys are probably wearing face shields. And if you're not, I actually really encourage you to wear face shields, okay? Because it wasn't until the pandemic that I started wearing a face shield. And once you start wearing a face shield, you'll notice when you take the face shield off, there's a bunch of splatter on there, okay? Oh, yeah. A lot. Okay, now imagine if you weren't wearing a face shield, maybe you're not wearing it right now. Where's that stuff go? Your hair, stuff like that. My hygienist used to say, there's been times where I found piece of calculus in my hair. I was like, oh my gosh, that's so gross. And so the thing is she was excited about this. So she started using it. Both of my hygienists use the Aerosol Assist. They use it so much that I don't even get a chance to grab it. I have to swipe it from them. So Dr. V, when we're done here off air, we'll have to talk about something. I need to get me one too. Okay. So the thing is what I'm trying to tell you guys is that we need to have as much protection as possible. Before, remember, he was saying people didn't wear gloves. Okay, now you wear gloves. Before, you now you wear like a thicker mask. Then you wear a face shield. And now the Aerosol Assist is just another level of protection. Because the thing is that, again, if you're wearing a face shield, do me a favor, take off the face shield and take a look at it. There's going to be splatter on there. What's so amazing about the Aerosol Assist is that when my hygienist, I go and I look at her face shield, there's hardly anything on there. And so, Dr. V, let me ask you this. I mean, again, you're the one who founded this. Again, he founded this. We had Werner on here. He's not just some guy off the street. The guy is an engineer. Okay, he came from that background, and Dr. V is like us. He's coming from a clinical background. So, Dr. V, let me ask you this. Have you noticed those things where people have come up to you and said, I used to get drenched? Because here's the thing, guys, we could be careful, right? But with some patients, just the way the saliva is, and just where depending on what tube you work on, there's going to be some backsplash, right? Oh, yeah. You can be as careful as you want. Dr. V, talk about that. Talk about the people in your office and you. Have you noticed that, hey, I'm not as drenched as much now that I'm using Aerosol Assist?
Absolutely. And we got lots of videos to go ahead and show that. And we also have lots of stories too, like some of them saying, like the patients are saying that they had a much better experience too. So like that's led to patients having a better experience, clinicians having a better experience. Literally, like I remember this one story where a patient had half the SRP done before a practitioner started using the Aerosol Assist. Then on the next appointment, they used it. And the patient told the practitioner that, oh, you improved, you got a lot better. And really, they did the same thing. They just used the Aerosol Assist. So that was a really nice compliment to, just using the Aerosol Assist to make sure that, you're providing a much better experience for the patient. So definitely we've seen a gigantic difference. Like people are constantly saying that, like you said, their face shield is a lot cleaner. And a lot cleaner face shield means it's a lot cleaner to go ahead and make it easier to go ahead and make sure you don't have to continue buying those disposable visors. So it's better for the environment. It's better for everyone.
And you brought up something that's really important too. We think about ourselves, but think about the patient experience. I actually, and it's totally different from it. But again, I like to use a comparison. I call it like the isolite or the dry shield, right? Mm-hmm. Before, could you work with it? Yeah. Could the patient deal with it with them? You let the water accumulate in their mouth and can you work like that? Sure. Can the patient take that? But when you use that product, it makes your life easier. And really, that's what the Aerosol Assist does. It just look, dentistry, Dr. V, you're a clinician too. I mean, dentistry is a hard job, man.
Oh yeah. You want to make
it a hard job, guys. It's a hard job. And if we can make it just a little bit easier, then but you know what? Don't take my word for it. Don't take my word for it. Dr. V, let's you got something to show us. Let's go through your when you have the show. And
you mentioned something though that's really I wanted to go ahead and touch on the development process. When we were actually developing this, it was a little bit more it had more things to it, basically. Like what we were trying to go ahead and do was just upgrade some previous isolation devices to make sure that they could go ahead and use it. But the problem is, this all started really when originally, before I even said I want to go ahead and create this, I actually bought a dry shield, and dry shield for me, it works fantastic. Mm-hmm. The issue was when I tried to give it to my hygienist or to all of my hygienists, they just refused. And the reason they told me is because they didn't want a bite block. It adds a lot of complexity, specifically of the fact that they have a standard way of practicing. Like as a dentist, you're going to be doing a crown, you're going to be doing oral surgery, you're going to be doing endo, and all those things require different things. For a hygienist, they have a protocol that they have to stick to. And that protocol, if something just gets in the way of it, they're not going to go ahead and like it, even if it is very beneficial, like the dry shield, because just the fact that you have to go ahead and pick different sizes, that's just another time that you're going to go ahead and have to waste. And then when you're going to go ahead and actually show it to the patient, they're like, oh, what is that? Like that's more time you're going to ahead and waste it. And then, this happens many times where you see this giant patient and then you ask them to open up and they're like that, they're not opening up at all. And you're like, crap, I got a large for this patient because it's a large patient. You expect to go ahead and use a large bite plug, and then you have to swap it out. And then that takes more time. By the time, you're actually going to go ahead and treat your patient, 15 minutes has gone by. when, this is literally one size fits all. You just need a saliva injector, you're ready to go. So that's actually one of the main reasons we developed something that's a little bit easier to go ahead and use, because there's nothing wrong with any of the other devices. It's just that this is to go ahead and I guess plug in the holes where one device probably wouldn't have been, the right choice to go ahead and do it. This is definitely going to be the right choice.
And I agree with you. And I agree with you with the hygiene department. If you make something hard, they will not do it.
Yeah,
they will not do it. And I totally agree there. And it's rightfully so. They have a certain way they like to practice. A lot of times hygienists are working without an assistant. With us, we have an assistant. So it's easier to do those things, easier to set everything up. But Dr. V, we actually have one question that just came in. Can you field some questions right now?
Absolutely. Let's do it.
So this doctor's asking, well, can this work with, and I guess you'll show this in the present, can this work with if I'm using a dry shield too?
It does use its own HVE line. So if you need isolation, I wouldn't recommend it. Like it can work with a rubber dam. If you need to go ahead and use like the ultimate form of isolation, there's nothing better than a rubber dam. So it can go ahead and integrate with it. In terms of can it work with the dry shield, it's going to be very cumbersome for it to work with the dry shield, because like literally it's supposed to go into the area where you're not going to need that visual, like the visualization.
Sure.
On the right hand side, you put it on the left hand side. Now,
I'm thinking like because the Aerosol Assist uses the hygiene vac, right?
It just uses a regular HVE.
Yeah. Okay. So if you have an extra one, you could use both. Like at least on my chairs, I have two of them.
Oh yeah, absolutely. Having two is not going to be the issue. It's just that where this hangs.
Yeah.
It's going to hang right here, and then you're going to have to go ahead and put the dry shield in the same place.
Yeah. I see.
The real estate of the mouth is not.
But hey, if you're using the rubber dam, it works. Instead of just sticking instead of just sticking the suction in there, you can actually have this here, and also it will probably be more comfortable for the patient too.
Oh yeah, absolutely. And again, it's the right tool for the right job. Like for the anterior cases, I only use the Aerosol Assist. For the posterior cases, I'm doing a crown prep. I need that stability, the isolation. A dry shield is the way to go. So it's not supposed to.
I love that. Yeah, especially for the anterior case, you're not gonna stick a dry shield in there. Exactly. But again, you still got the aerosol. That actually, I will say this, Dr. V, the anterior cases is where you got to be careful about getting splattered.
Oh yeah, absolutely.
I mean, you're doing that number 8 and 9, and you're just focused on that. You look up and your shield's filled with stuff. Especially when your assistant trying to get around, they don't want to get in your way, and so they're not really suctioning anything. They're just putting it behind the tooth. All right, let's just dive right in here.
Let me see if I could stop this from actually. Okay, so these are the top 5 reasons adding the Aerosol Assist to our armamentarium. The first, we're going to go to dentists first. So one of the biggest reasons, obviously, it's because it's the most cost-effective option. When you look at all the other devices that exist, I combine them to make it easier to talk instead of talking about each one individually. So we're talking about HVE isolation devices, things like the dry shield, Isolate, Isolate 3, Isolate 2, HVE handheld devices. Those are those mirrors that you have to hold on. HVE hands-free devices, that's like the relief. Obviously the Aerosol Assist, and then extraoral aerosol suction devices. Those are those big elephants that you go ahead and wheel into the room. You can see that the cost per unit is going to vary amongst each of them. And ours is definitely the most cost-effective option. And this is obviously for a single chair. And that's going to be important because as you continue to use it, that's where the Aerosol Assist is going to even shine further, because as you continue to use this, you're going to go ahead and see that the annual cost of using whatever product is going to go ahead and start increase. Whereas the Aerosol Assist, literally, like as long as you sterilize them the right way, that should go ahead and stay constant.
I love how you start off with this, because you know how dentists are thinking.
Oh, yeah.
Right? We're thinking like, hey man, this is another thing we had to pay. What's up with that? But I love how you lead with that, and it makes so much sense there. So
absolutely, yeah. No,
hey guys, I want y'all to know, this is a dentist here. Okay, he's one of us. He knows what he's talking about. It's always refreshing to have another dentist here who created a product, because you know exactly like what we're dealing with. We think about it. There's a new product. You think, what, more disposable? Oh my gosh, this and this. But really, when you compare it to everything else, I mean, it's so much more affordable.
Oh yeah, and the thing is that We did primarily see that hygienists are championing this product. And again, hygienists are the ones that have the most procedures loaded up on their schedule. So you want to make sure that they are protected too. And it's not costing an arm and a leg to go ahead and do that. And that's exactly why we created the Aerosol Assist, because literally, again, there's nothing wrong with any of the other devices, but to go ahead and continue using them, it starts to add up, and it starts to add up quickly. Like I never even thought to myself, let's go ahead and check on a yearly basis how much we're spending on this. And literally just for one of the devices, you're spending $15,000 if you're using, like, I'm not going to name any names, but as an HV isolation devices, people can go ahead and guess.
Yeah.
All you have to do is look at the bank account and see where the money's gone, and you'll guess which one it is.
And that's the thing too. I love when you brought that up. Look, I mean, we're not saying, guys, you have to switch or anything. All we're saying is like, hey, it's not cost effective in certain procedures. Like if you're gonna go, if you're gonna go do a like a crown seat, or if you're just gonna do an exam, are you gonna use one of those devices? No, man, you wouldn't do that, right? And so again, in the hygiene department, if the hygienists are already liking this, why are you forcing them down that road? Again, you heard what Dr. V said. He was like, hey, can you start using it? They're like, no, we don't want to use it, right? So again, this is something my hygienist uses it. Both of them use it. And I use it when I can, when they let me use it. But again, even I can see that there's certain procedures, it's more cost effective. But here's the thing, it makes your job easier, makes the patient's life easier. And that's what it's all about.
Yeah. And that's another thing. We made everything on the Aerosol Assist except for the fact that you have to use a saliva ejector, autoclavable. And that's what brings the cost down in using our system. All the other systems usually require devices that are single use, which is, for infection control, there's nothing better than single use, but it's bad for the environment. And we made this incredibly simple to go ahead and clean all the internal line angles. Again, like because of the fact that, like you said, I'm a dentist and I was working with a biomedical engineer. We got the best of both worlds. We got it designed by a dentist, but it was engineered by a biomedical engineer. So like sometimes when we were researching all the other products, we would be able to tell if a device was just made by a dentist without any help from an engineer. And then the opposite, when it's made by an engineer for a dentist, but with no consultation from an engineer, like they're vastly different. I'm not going to go ahead and name any names, but like literally, like you'll be like, we're thinking about making like a different video topic just on that. You need help from one or the other.
I think you and I have been through that where someone designs something and I look, is this even work in a mouth? It seems like it works in like a horse's mouth. Okay. And then if a dentist, there's been products where dentists come out and it's a good idea. They just didn't have the engineering capability. It was just, it just fell apart or it didn't work as well. This is the best of both. And that's why I'm so excited about it because, hey, look, the designed and created by a dentist and engineer. That is like the best scenario there when you're bringing a new product out.
Absolutely, absolutely. So, the yellow one, like I said, that's the yellow lines over here are going to go ahead and represent how much you're paying for on a yearly basis. The red line is going to go ahead and be the cost per chair. And then the blue line is the original price point that you would pay for the entire kit. And you can see that we beat all the other competitors in every single category. The only one is that one in the middle, and that's just because that company is so brand new that we don't have any prices on them. That's why there's no yellow there. But the second reason is it automates simple tasks. Simple tasks are, just removing aerosols and intraoral fluid. You want to make sure that these things are done automatically, especially that no thinking is involved. We made it so that's incredibly simple. One of the reasons we did this is just because, when you're working with the standard saliva ejector, like literally you put that thing on or it drops off on the floor or patients pick it up. It's just really, really annoying.
I love it because it happens all the time. That's just
exactly.
It's doing whatever the patient tries to become an assistant and they're like getting all in the way. I just love how this is, you just do it.
Exactly. Yeah. So like, I always say you put the saliva ejector in one way, it's going to do 100 different things. 100 different tries is 100 different positions. And that's because you have to go ahead and create two different curves on the saliva ejector to install it correctly. The first curve is just to go ahead and hook it in the mouth. And that's an arbitrary curve. The second curve is to go ahead and get it to the saliva, to get it into the saliva. And again, you put 100 times, you're getting 100 different results. This is literally just me just putting it in. You can see that it's never going in the same spot. You know, I didn't change anything, but and you can see that the same thing. But because you're using the aerosol assist, once you go ahead and you put it into the saliva ejector, or the saliva ejector into the aerosol assist, we then use the anatomy of the aerosol assist to go ahead and help you guide where the saliva ejector is going to go. So once you go ahead and clip it in, you could go ahead and see that I could bend it whichever way I want. So if a person has a really big tongue, you can make it so that it bypasses the tongue. I've used this on patients that have horrific gag reflexes. And because of the fact that the aerosol is hovering on the lip, you can see that the saliva ejector is just floating there. And as long as you put it as deep as possible, it's going to be able to remove all the saliva without necessarily engaging in the gag reflexes. And one of the things that we found out too is even though a patient could have a bad gag reflex, it's all psychological. So like literally, like sometimes a patient just he sees you walk into the room and just start like throwing up and making these sounds. But I've been like, especially this patient actually is a patient that's an extreme gagger. And you can see that the saliva ejector is literally touching the soft palate. And it's because as long as she doesn't think, because at the first time I put it on, it was obviously hovering, that it's going to be causing a gag reflex. When it actually touches the tissue, she doesn't remember. That psychological trigger has been skipped because it originally was set up so it doesn't have to go ahead and it originally touched the mucosa. But you can see there that this is literally a patient that, again, she would have saw me and she would have started gagging. And you can see that the saliva ejector is buried deep down in there. I wanted to take that video. So then obviously it's the right tool for the right job. I use this in all my anterior restorations, like veneers, crowns, composites, and in laser surgery. There's like no other tool that's going to be better for those things. And it's because, again, if I'm working in the anterior, I want something that's going to focus on the anterior. That's exactly what the aerosol assist is for. So it's not necessarily for hygienists because again, for them, 99% of the time, they're going to choose an aerosol assist over any product because it's geared for them. But for a dentist, this might work maybe 25, 40% of the time because, we're not working on the anterior all the time. And sometimes we do need that stability. We do need that isolation. But when we don't, then this is definitely the right tool for the right job. And here you can go ahead and see how much of a difference that it's able to go ahead and save the aerosols from flying into your face. The interesting thing about this video too is when I was taking this video, like I'm the guy holding the handpiece, right? Yeah. And when I'm taking it, from my point of view, I saw no difference between these two. It was only until I actually started to see the video that we saw that, holy crap, that's a lot of aerosols being generated. Now this is it being used on a real patient. The saliva ejector is on the right-hand side. I don't know how grainy it is, but you could definitely see the aerosols being produced.
Well, you can see the splatter.
Yeah.
And you can see the splatter come up.
Exactly. And you could also see she's actually like swallowing a lot too. And she swallows a lot, obviously, because the saliva ejector is not positioned correctly. And then actually we stopped this video because she had to like dry her face. Here, though, you can actually see it working really well. You can see the particles going in and creating something called laminar flow. Laminar flow is something that's able to be achieved here because our device is fixed. It stays on the cheek. So literally, because it stays on the cheek, it stays in one position to allow all the particles to go ahead and move in a continuous motion. What you don't want is you don't want this to go ahead and be disturbed. Like, for example, if you had one of those handheld devices, the fact that you're moving it around means that you're not going to create that laminar flow because the point where the suction is going to continuously change. For anterior cases, it's really, really great. You can actually see how powerful it is over here. I'm just turning on the high speed and you can see that it's suctioning up the bigger spatter particles, because I wanted to show how it's going to go ahead and work with aerosols, which are the tiny particles, and with giant spatter particles. But again, even with both of them, it worked really nicely.
Well, Dr. V, let me ask you this again. We've all been in this situation where we're working on, an anterior tooth or maybe, even like one of the bicuspids, and sometimes you'll work and you'll get all this fluid on the patient's face and you're spending half the time like wiping their face down. Yeah. What have you noticed when you're using the aerosol assist? How often do you have to go and wipe someone down while you're working?
Yeah, it's definitely a lot less. Most of the time when I have to do it is just because like I lifted it up without stopping the high speed, and
Sure,
nothing's going to stop that. I found two really important things that have sped up my things when I use the aerosol assist. Number one, the patient doesn't lift up the saliva ejector from their mouth anymore, because they, even subconsciously, like most of the time, actually, they don't even know that a new device is even being used. And I'll talk a little bit about that later, but they subconsciously understand the importance of having something there that is already positioned correctly, because again, they're lifting it up not to go ahead and be a pain in the ass, but because it's uncomfortable. That saliva ejector is probably like probing the back of their throat when like literally
but it's probably pinching their side of the corner of their mouth too.
Exactly. Like it's doing a bunch of random things, and we just eliminated all that. And then in terms of the splatter, yeah, like with the splatter, literally, like instead of it being like 4 times in the procedure that I would do, I'd probably do it like 1 time. So like it saves a lot of time for the patient not having to go ahead and wipe themselves. And if it is, it's, you know, it's 1 or 2 drops, it's still nothing compared to, you know, like I'm asking a patient, what kind of shampoo do you want to use? Because
well, that's the thing. That's the thing too. It's a hassle for us, but can you imagine the patient? I mean, we've been on the receiving end, right? When I get my cleanings done, I've been on the receiving end where that suction has been hanging in my mouth, and I was covered, like literally I just took a shower. So think about when you get your own teeth clean and how that feels. Again, that's one of the things that sold me on Aerosol Assist, is that actually I got my cleaning done with that in my mouth. And like Dr. V said, after a while, I just actually forgot about it. I didn't even think about it. But when that suction is hanging there, you're constantly moving it, you're constantly closing on it. You're an active participant. You're almost like the assistant. And again, this is just to make everyone's lives easier.
Yeah, and the great thing is that it does allow you to use something like this, a saliva ejector, to be completely customizable. Because like, for example, for when I was using it on a majority of my patients, they don't like it when it digs into the raphe. For some patients, as silly as it sounds, they prefer it there. And again, I'm not going to go ahead and judge them on why they like it there. I think it's incredibly uncomfortable, but if they prefer it there, they prefer it there. And this could go ahead and, you know, give you the choice if that's what you like. And then another thing is it optimizes the dental assistant role. The aerosol assist is going to allow the assistant to pretty much do a lot of other important tasks. And that's really important, especially in these times. It's been shown that 80% of hiring dentists find it difficult to find hygienists, assistants, or just pretty much anywhere, you know, like any kind of front desk or staff has become an issue because of this current crisis. And if that's going to be the case, we need to go ahead and make sure that we optimize the roles of the people who are still in our staff to make sure that they are cross-trained a lot more. So we want to automate all these tasks that can be automated, one of them being the aerosol reduction and saliva and removing saliva from the patient's mouth. So if you could automate that, then now you have an assistant that's able to go ahead and do things. And if you do need an assistant, they're able to go ahead and provide much better results, because they could focus on the task at hand instead of doing things that can be automated. I
mean, if you have your assistant in there too, I just imagine you have the saliva ejector going, and then they have their actual suction, the high vac suction where you're working. I mean, between that and then also the aerosol, it's almost, I'm not gonna make people mad. I'm not gonna say it's just like a rubber dam, but it's as close as you can get, okay, or even as close as you can get to an isolite without having to put that on a patient. Right. So, and again, hopefully you'll show how easy it is to put on there, because here's the thing, like I'm still having to put rubber dams on my patients when I use it. And my assistants is okay with that. But this literally, you can get anyone and train them in less than 2 minutes.
Yeah.
They'll know how to use it.
Absolutely. Yeah. And it integrates very easily. And that's one of the other things I wanted to go ahead and make sure that we do. Like I didn't want it to be required to have like special hoses or, you know, special connections. Like just pretty much if you have a HVE and a disposable saliva ejector, you're good to go. And that's exactly why I have this video over here. So you can see, like in this video, we're going to go ahead and go over how to install a saliva ejector and then the aerosol assist into the HVE. It's a little long, so I apologize for that because we're done. Actually, it wasn't long. It only took 8 seconds to go ahead and do that. Like literally, if you have an HVE with a proper O-ring on it, like that thing is going to be stuck. It's not going to accidentally fall. And as long as you have the, a good amount of tension on the hose, it's not going to go ahead and pull on the patient. You put the patient on a supine position, you install the Aerosol Assist on the cheek on the patient, and they're good to go.
And Dr. V, I want to point out something. I'm not gonna mention anyone by name. We already mentioned like Isolite and Dry Shield, and that has its place here. But I'm not gonna mention these other companies. There's other hygiene products, suction products for the hygienists use that are really good and they serve their purpose, but they do not reduce the aerosols.
Yeah,
they're nice suction. They clamp really good, right? That helps there. But this does that job plus reduce the aerosol, and plus it's autoclavable. So again, if you're thinking about getting something for your hygienist gave you like these 3 other products that, hey, it helps suction, the saliva. Well, ask yourself, is it going to reduce aerosols? Is it going to be comfortable for the patient? And also, here's the big one. If you're a dentist, you're probably thinking, man, how many of these do I got to buy? Do I have to buy? Do I have to dispose of after every procedure? No, Dr. V just says it's autoclavable. And speaking of autoclavable, how many uses normally? I'm sure obviously you use this in your practice all the time, but I'm sure you and Warner just went through and just like abuse some of these and see what you can get through. But let's just, what's a fair expectation of like how long one of these will last?
Yeah, absolutely. Well, the first thing is I've had mine for 9 months. So they last quite a long time. We guarantee them for 6 months. So if anything were to happen within those 6 months, we'll just replace them, no question asked.
Well, there you go.
We want to make sure that we both trust, because we're a new company. We want to make sure that if you're buying our product, like literally user error shouldn't be your fault. Now there is a specific way to take care of them, and to take care of them is just putting them in an autoclave at 250 degrees for 30 minutes on the top tray. Now the reason it has to be the top tray is because even though the material, I mean, when we were doing this, I didn't know how many different types of plastics there were, how many different types of materials you could go ahead and choose from. So it's not just your regular plastic. This material is specifically chosen because it's incredibly light, it's incredibly durable, and you're able to go ahead and autoclave it at temperatures even higher than 250. But to go ahead and prolong the life, I would still recommend 250 is your max. And if you are able to do that by putting it on the top tray so that no other tray or no other instrument is squeezing this, then it should last anywhere between 150 to 300 uses. But again, I've definitely gone over that number. We just want to go ahead and set minimums.
Sure.
And protection too, where in 6 months, if something were to happen to it, we got your back.
And that's the thing that you guys really, really need to focus on, right? It's like these are autoclavable. They're supposed to go into the autoclave, and all you got to do is just put it on the top tray. Don't put a whole bunch of stuff on it. Okay. Yep. So again, that's the thing. Some of you guys are saying, oh, well, I can use these other things, but I can't autoclave it or whatnot. Well, just ask yourself this. I mean, would you want those things in your mouth? I mean, come on. You want something that's been autoclaved, okay? And so again, he gave you a minimum between 150 and 300. That's a ton of uses right there. And,
and 6 honestly, in the kit, so that's a lot more.
I mean, it's and here's the thing, that's the minimum, right? And again, they believe in their product that, look, if something happens in less than 6 months, reach out to them, right? But up to 6 months, I don't think there's any other company that will offer that type of guarantee.
Yeah. So now we have, 5 reasons why a hygienist is going to go ahead and like it. Obviously, they have different priorities. Again, they have a more packed schedule and they're protocol orientated. So their reasons are going to be a little bit different for a dentist. The number one reason is it automates simple tasks. Again, because you don't have to necessarily pick, is this person large, small, medium, whatever. It's just one size fits all. We don't have a small version of this. It's just one size. So literally, like we've used this on someone as small as 6 years old to 90-year-old patients, and they all are able to tolerate it really comfortably. The interesting thing too is because of how comfortable it is, when we were actually first developing this, we actually asked patients to sign a consent form. Look, we're going to try a new device on you guys. And once they signed that consent form, we did the procedure. At the end of the procedure, they would ask us, did you use the device? because they were waiting for it. And they didn't realize that we did it. We would ask them, is your face dry? And they're like, yeah. Is your bib dry? Yeah. Then we use the device. And they would often ask, oh, I didn't even notice it. And then I would ask them out of curiosity, what do you call this? Like, what do you call a saliva ejector? Like, oh, I don't know, the thing that hangs on the side of my face. Well, this is the thing that hangs on the side of your face. So like they couldn't differentiate between this and this. So that makes it a much simpler task to go ahead and automate, because now you don't necessarily have to have that discussion of what is that thing you're going to go ahead and put in my mouth. I've never seen it before, especially if some of these devices, you orientate them the wrong way. They look like they're going to go down your throat instead of like ice. But again,
just to back you up on that, each time I pull out one of those isolation devices, they do ask me that. It's like, is that going down my throat? I was like, yeah, it's not. But it's true. They always ask that when you pull it out.
Yeah, I always say, oh, don't worry, it's a suppository. to make it a little bit easier for them to tolerate it. So, the fact that it is one size fits all makes it a lot easier. The fact that they can now make the saliva ejector a much easier placement saves a lot of time. And the fact that the patient doesn't have to pick it up or move it around or readjust. Once you find the sweet spot of where the saliva ejector should go, like you take it out for whatever reason, you put it back, it's going into that same spot. So it automates a lot of different tasks to make it as easy as possible. Another reason is, like I said, it integrates very easily. So especially for hygienists that go into multiple practices, this is much easier to go ahead and carry. And especially since another practice is going to have HVE and another practice is going to have a saliva ejector, they just have to carry 6 of these and they're good to go for the entire day, and they know that they're protected. So it's portable, and that's very necessary. And you only need an HV and a standard disposable saliva ejector. Most patients won't have to, you don't have to waste any time on again in explaining on what they do. And it just makes it a lot easier. It provides a safer working environment. That's definitely more important, because in the same way most hygienists tell their patients that chronic inflammation is going to be what's going to go ahead and lead to gingivitis, periodontitis, it's the same thing for any part of the body. If you're consistently breathing in these particles, it's going to go ahead and cause chronic inflammation in your lungs. And that's been proven in a lot of different studies. But there's this other study that I found very recently, something called idiopathic pulmonary fibrosis, meaning idiopathic, they don't know where it's coming from. And it's just your lungs is essentially getting so much scar tissue that you're unable to breathe. That's a terminal illness. One interesting thing, though, is that there's a 20-fold increase in those patients that are dental professionals out of any other profession. Okay. Now, no one knows why it's happening, but it's interesting to note that if you're a dental professional, you have 20 times more likely than the rest of the public that you're going to go ahead and get idiopathic pulmonary fibrosis. Again, this is something that needs a lot more research. And this is something that if you could go ahead and avoid finding out, should you have gone and fixed this problem from the get-go, you can start doing that now. You don't have to wait until there's a consensus of, yeah, you should have done that. Because guess what? In the 90s, there was no consensus to wear gloves.
Yeah.
And in fact, when the ADA were being told by the government to, now every single dentist has to go ahead, they fought it. They fought it specifically because of the fact that they're like, well, not too many people are getting AIDS. Not too many people are we don't need to do universal precautions because the amount of people getting sick is not that many. So why should we all glove up? That was an actual argument that they actually used to try to fight having universal precautions for wearing gloves if you're going to be working in blood. And that shows you that, no, you shouldn't necessarily wait for a government agency or for even our own ADA to go ahead and say, yeah, you should be doing this. You should use common sense. There's no reason to breathe in aerosols. This is going to go ahead and not just make that problem go away, but just make it easier to work with in general. So why not do it? Especially if the patient's going to go ahead and enjoy it more, especially if it's going to go ahead and save you a lot of time and a lot of money. For the hygienist, that's very important, and obviously for everyone else. And it increases productivity as well. If you're consistently putting the saliva ejector in the right place, it's going to also increase the longevity of your PPE. Like you said, your face shield, the mask you wear, the gown you wear has less splatter on it. It has a little bit more life on it, because once it's soiled, you should go ahead and throw it away or clean the face shield. But now that you don't have to do that after every single appointment, you'll be able to go ahead and see that. That's going to increase the shelf life of those individual components. That again saves time, saves waste. Why not do it then? And obviously, again, a better patient experience. Some patients, they can't open wide, so they can't, and that was one of the biggest reasons that they didn't want to go ahead and use anything that had a bite block in it. In fact, when we were actually originally designing this, we actually had a bite block designed into the product, but as soon as we gave them to the hygienist and we turned around, they weren't using it. So literally, like, this product, the only reason it's available in its current form is because we saw that once we turned around, they were actually using this. And that's how you know that the product is going to be functional, when you don't have to necessarily force somebody to use it. They, on their own volition, are going to say, this is the right tool for me, because it is going to go ahead and cause a better patient experience now that their face isn't wet. It is going to cause a better patient experience now that they don't have to go ahead and gag. It is going to cause a better practitioner experience, because that stuff isn't on their face. The cleanup is much, much, much easier. So yeah, it's a great device for the hygienist, and those are the 5 reasons why. Now, for an assistant, it's again, where their orders are a little bit different, but it's going to be almost the same things. It's automates tasks, so it's again better four-handed dentistry. Here, for example, I had my assistant holding that piece of tissue. Let me just mute this. And actually, my assistant in this example was somebody that's never assisted their entire life. Okay. So she's holding this tissue. She's never seen a surgery before. She's freaking out, obviously. But so she needs to focus, and do you think it would have been good if she's able to go ahead and has to manage that laser plume? Because, I mean, you didn't even see the laser plume, but it's the same procedure. It's the same laser, actually. I made sure that it was the same laser with the same tip, but all the laser plume is being removed by the Aerosol Assist so fast that you don't even see it. Here, maybe you go ahead and see it. And mind you, I don't need an assistant at this moment, because she was using it to hold the upper lip and she was using it to hold that tissue. But now that she has focus on only two different things, she doesn't have to focus on intraoral fluids, and she doesn't have to focus on removing the laser plume. And what was interesting about this too is, originally, we didn't make this device to go ahead and say we're going to tackle laser plumes as well. But that was actually the first time I actually did this procedure, and the entire office didn't smell like burnt bacon in a microwave.
I think that's huge too, because again, how many times how many times have you had a patient just talk about that? Like, man, it sounded like you were burning something off. It was unpleasant for them, unpleasant for you, unpleasant for the assistant. Heck, it's unpleasant for the whole office, because they could probably smell it. So I love using this for these procedures. That's just you can, and when you have those side-by-side video, you can actually see what the aerosol. I mean, look at that right there, guys. I mean, look at that right there. That's, for the dentists who are looking, it's like, okay, I get it for my hygienist, but what about me? Well, look at this. Yeah. Pretty much everyone has a laser in their practice now, or at least an electrosurge, right? Yeah. And if you're still using electrosurge, you definitely know what that gives off, right? And so I love using this for these type of procedures. Yeah. And again, and the assistants love it too, because now they could just only focus on the task at hand instead of things that can be automated. If you can automate it, automate it. That's the takeaway for that. It also, again, provides a safer work environment because it reduces aerosols and splatter. So, and that, like I was saying before, that last video, I couldn't smell it. And, I was telling you before that itchy throat that I used to go ahead and get every Friday, Saturday is now completely gone. And that's something, again, like I was pleasantly surprised that that's not an issue anymore. I was embarrassed to go ahead and admit that it took a long time to figure out where it was coming from, because literally, like, it took, if I graduated in 2009, I didn't start working on this until like 2015 or 2016. It took a long time to say, you know what, maybe it's because of where I work that I'm getting all these problems in the weekends, because it literally 3 o'clock Fridays, it's right on schedule. It feels like I'm about to go ahead and get sick. So hopefully no one else is experiencing that, but
That's definitely one of the biggest reasons I actually started doing this. And again, because of where we are, it just frees up the time of the assistants. They could start focusing on setting up for the next patient, sterilizing, lab case management, and more importantly, cross-training, because we're limited again in finding new hires. So we have to go ahead and make do with what we have. And if what we have is just, I definitely have a much smaller staff right now. And I want to go ahead and make sure that they're cross-trained so that if one of them does get sick, or if one of them just doesn't want to come in, like the office keeps humming along. And the last thing I want to go ahead and do to them is give them something that can be automatically done for them. In the same way, no one's picking up after hours. They let the voicemail get it. So like literally working without one of these is like deciding to not use your voicemail feature in your phone or anything that else makes your life a lot more convenient. This just makes it a lot more convenient to go ahead and be able to do what you're really supposed to do. And then less cleanup time. The cleanup time, obviously, if it's reducing aerosols and spatter, like literally you can see the difference here. That all I did here is as went from canine to canine. I used a non-toxic dye that was put into the water and shown, and I put a lot of black lights on a procedure, which again, I did a mock cleaning that I went from canine to canine on the top and canine to canine on the bottom. And you can see the difference here of how much splatter is being generated in just that quick little procedure. Here it is actually live. And you can see that like that stuff is just going everywhere. And you can imagine that if I actually really did this, I wouldn't necessarily go that fast. And you can imagine that that face is going to be a lot wetter. Now, mind you, like most of the time, you don't necessarily notice this because of the fact that it's clear. And that clear liquid, it's getting on the chair, it's getting on the patient's face. The patient touches their face, touches doorknobs, it's going everywhere. So like, which one would you rather go ahead and clean after? The person on the left and the person on the right? Who's going to go ahead and pick the person on the left, especially if—
And then the patient too. I mean,
exactly.
They're feeling all that stuff.
Mm-hmm.
I mean, it's if you're looking at the patient without the aerosol says, I mean, that water is on the back of their neck.
Yeah.
I mean, again, yes, and it gets your chair wet, it gets everything else.
Yeah.
And we're not even talking about what's going on in your face.
Yeah.
That's the thing too. So again, so many people, they just wore their loops with no face shield. And then with the pandemic, everyone's wearing a face shield now. So again, for those who are watching right now and you don't have an Aerosol Assist, just do me a favor. Look at your face shield. I mean, I guarantee you're always wiping it down after every patient. Now you could say, okay, well, I can wipe it down. Well, unless you're wearing a hairnet, unless you're wearing a cap, you don't think some of that water's on your head?
Yeah.
I mean, that's the thing too. People are like, well, I'm wearing a face shield. Okay. You don't think it's on your jacket? You don't think it's on your pants? It's probably on your pants too. You don't realize that, right? I mean,
I get everywhere.
again, my hygienist was talking about how there's been times where she found a piece of calculus in her hair. I mean, as gross as it sounds, that happens very often. So why not put an extra layer of? Here's the thing: we understand Dr. V's he's a dentist too. He wants to save money too. We all want to save money, right? So we're thinking about, the face shield, we're gonna replace them, all this, and that. Well, here's one thing that is gonna last you at least 6 months. At least, and it's probably going to last a lot longer, right? Dr. V just said his is lasted 9 months. He probably could get it through the whole year. So if you look at that investment and what it does, I mean, it's a no-brainer, guys.
No, absolutely. And it simplifies your protocol too, in terms of like the assistants picking what needs to happen to set up for a procedure. Like they are automatically know if it's an anterior crown, anterior restoration, Aerosol Assist. If it's for hygiene, Aerosol Assist. Posterior crowns or restorations that are going to be in the back, that do need an isolation device. I definitely use other devices as well. It doesn't mean I'm married to this, because again, it's the right tool for the right job. But now it makes that process of selecting which tool for the right job much, much easier. Whereas before, I'd get a lot of questions of, do you want to use the dry sheet for this procedure? Do you want to use this for this procedure? Do you want to use that for this? That's no longer the case anymore, because it's all been automated. So automation makes it easier to go ahead and simplify what you need to go ahead and do. It makes it easier to go ahead and focus on more complex problems instead of worrying about, do I need to go ahead and just use a saliva ejector, this or that or that? No. If it's an anterior case, Aerosol Assist. If it's for hygiene, Aerosol Assist. That's for sure the right device to go ahead and use. And then there are other devices that are going to be more appropriate. And so we're not necessarily trying to replace any device. We're trying to complement existing systems. And then, how much time do we have? Because I could definitely keep going.
Well, let's talk because I think like you showed so many reasons why. I mean, this makes sense, right? So let's just dive right in, because everyone always wants to wait for the Nifty deal and they want to know what it is. So let's talk about like what it looks like you're going to go through the costs here. So let's just go through this really quick and then just talk about like the Nifty deal, because again, a lot of times people think about this, they're like, okay, it sounds great, but it sounds like it's going to be super expensive. But I want to tell you guys right now, it is not as expensive as you think. But I'll let Dr. V talk about that. So kind of go through this real quick, and let's talk about the pricing and the deal for our members.
Okay. Yeah. I mean, this is going to be very, very quick. It's just pretty much what the isolation devices are able to go ahead and do. Some of them, like none of them, are actually able to go ahead and say that they have dedicated aerosol reduction that's hands-free. Okay. Because it's a byproduct, as in the fact that you're using any of the isolation devices are going to help with aerosols, but it's a byproduct of the fact that it's creating an intraoral vacuum in your mouth. So if you start to go even a little bit outside or the anterior teeth, guess what? You don't have protection in those areas. So it's the right tool for the right job. But if that's something that you require, like on an anterior case, for example, it's not the right tool for the right job. So another thing is obviously well, I'll just skip on that, but you could go ahead and see that, that they do tend to be a little bit pricey, somewhere between $300 or $1,900. There's so many isolation devices that I don't want to go ahead and necessarily pick on one, but that's usually the range that you're paying for. For the handheld devices, these are very popular amongst hygienists. They're the ones that are the mirrors that have to be held in the hand.
That stick onto the suction or the retractors and whatnot. But again, you still got to hold on to it.
Not only do you have to hold on to it, but then you have to go ahead and pick. Am I going to use this for aerosol reduction, or am I going to use it as a mirror? You can't necessarily use it for both at the same time. Sometimes you have to use it, especially if you're working on the lower anteriors. You have to go ahead and use that as a mirror more than anything else. So like if you're or as a retraction device as well, you can't use it for all three things. So the fact that you have to pick and choose, if I move this to go ahead and reflect this tissue, then obviously the aerosol control is not going to be as nice as when I go ahead and put it directly to the source. So you have to go ahead and pick, and that's not going to be something that is, and especially because of the fact that you have to move it around, that's going to cause two issues. Number one, fatigue. And that's something a lot of people don't realize until it's way too late. I had a staff member of mine actually that had to go into surgery this Christmas or last Christmas, and she's not going to be able to go ahead and work in dentistry. Well, hopefully she can, but who knows? If she's going to be able to go ahead and work in dentistry again because of that shoulder surgery. And again, it's just because like I would see her sometimes and she's holding instruments like this. Over time, that's going to go ahead and become an issue. And I personally experienced that in terms of improper holding of an instrument or just standing incorrectly. It's really important that we go ahead and take care of ourselves in a lot of different ways. So these devices, they could have their practical applications, but you just have to make sure you have really good ergonomics when it comes to this. Then the hands-free devices, initially the things that could go ahead and make you want to get these devices, they seem like they're inexpensive in the beginning, but they end up being incredibly expensive in the long run because they're usually single-use items, and these single-use items are going to go ahead and take their toll, especially in a year, especially if you're using them for procedures that are going to be the most common ones, like hygiene. You want to make sure that, as you optimize how much you're spending per patient. And then the extraoral aerosol suction device, those are those big elephants. I had a friend of mine that said that they got it for the pandemic, and they have their place. Like for example, I would use them on a patient that is very sick, but they need work done. It's a great device to go ahead and use for that because you want the most protection. And
but it's expensive, man.
Yeah.
Let's just be honest here. Like it's expensive, and honestly, it kind of looks scary, man. I mean, again, for us. For doctors, we're okay, but like when a kid sees that, they're like, "Oh my gosh, it looks like one of those aliens that will suck your soul out of you or something like that." So it is scary. And then also everyone's every practice is different. You might not even have enough space to fit that thing in there.
I was going to that. Yeah, absolutely. Yeah. Like I asked one of my friends, like if he's using it for all his procedures, and he's like, no, we actually, because, initially he's like, oh, I got this. It seems really cool. Then I called him a couple months later and he's like, you know what? I don't even touch that thing anymore. Cause like once we put it in one room, it just permanently stayed there. There's no, like, it's annoying and cumbersome to go ahead and try to get it in between your cabinets and your chair. And most of the time, to try to go ahead and get in as many ops possible into a space, that you sacrifice some of that area. And so like to go ahead and get these devices in there, it could be a little bit problematic. So again, it's not to go ahead and say that they're bad devices, not at all. They're excellent, again, for that specific patient where you want the highest level of protection. And again, you can even use an Aerosol Assist in conjunction with that. So you can have two different forms of protection on. And, like, so it has its place for sure. But in a general setting for general purposes, like especially for hygiene, it's most likely not going to be the device of choice for the clinician or for the patient, for anybody, because again, you're definitely having a conversation of what is that, and it makes a lot of noise, and obviously it's going to add a lot more different steps in terms of maintenance, cleaning out the filters, things like that. No one really knows exactly how expensive this is going to go ahead and be in the long run, because it hasn't been the long run. Like at most, some people have had this for like a year. What's going to happen in 2 years? What's going to happen to the filters once you go ahead and change them? So like they do have their, it's reason to go ahead and get it, but you have to make sure that you think about how it's going to be practical for my way of practice.
And honestly, what I would tell everyone is before, again, we'll go into this when Dr. B talks about this right here, but I would say like if aerosols is your concern, right? And that's the reason why you want to buy that big machine, that extraoral aerosol suction device, use the Aerosol Assist first and see if that helps, right? Because chances are it probably solved the solution and it just saved you a lot of money. Now, if you feel like you need more, okay, go from there, right? So again, it's all about, as a clinician, we always want to be as conservative as possible, right? Oh, okay, let's do a crown on that tooth, right? Let's possibly, depending on what kind of dentist you are, let's do endo. You don't go just, let's just skip the crown. Let's go straight to an extraction and implant. Yeah. Right. You would never do that. Right. So when you're making these decisions about aerosol, why don't go all the way to one extreme? See if these steps will go, and chances are, if it saves you a lot of money. And for the cost, and I'm just saying this because we're about to talk about cost and a Nifty deal here, but I would say the cost of one of those devices, you can equip your whole office with Aerosol Assist and take care of everyone the whole day, right? For that price.
Absolutely.
So, but hey, we'll find out for sure with Dr. V what he's going to tell us here soon.
So the link is at the bottom. It's aerosolassist.com/nifty-thrifty. If you click on that link, they'll take you to get the Nifty deal. And that Nifty deal is $2.99 for a pack of 6. So that roughly comes out to $50 a unit. And if you use it with the cost of a standard disposable saliva ejector, that comes out to 30 cents per use, which again, when you compare it to anything else, it's like the closest thing that comes to us is like $1 per use. So literally using any other thing is going to be a lot more expensive, to say the least. So that Nifty deal is available again through that website down there. And it comes out to $2.99 for a pack of 6, just to make sure everybody heard that again. And here you go ahead and see that when you look at, on all the other, options that exist, like you can see that the Aerosol Assist is able to go and hit as many check marks as possible. And again, this was because of the fact that we needed to make sure that the device is going to be used. So like the fact that it doesn't have a bite block, even though we are going to go ahead and eventually develop one or redevelop it, because we already had it. We actually had to take it out. We wanted to make sure that this was usable for the practitioners that are going to use it the most. And that's exactly what we did. That's why it hits all those check marks. Now, just because you see all these check marks and the Aerosol Assist has a majority of them, it doesn't necessarily mean that the other products are worse. It's just, is it the right tool for the right procedure? Where ours most likely is going to be the optimal choice for all anterior cases for a dentist, and for every single hygiene procedure. It's definitely the go-to for a lot of different practitioners And we've been seeing, especially that's been coming true for, we've luckily had, it's been a gigantic blessing to go ahead and get this into the hands of a lot of different practitioners who had all these devices because they needed to go ahead and see, which one was right so that they can make recommendations. And a lot of them said that this was the device that they've been waiting for a very long time. So I was really honored for them to go ahead and say something like that because, like I just wanted it to, help out as much as possible. But to hear that literally, it makes me smile even to this day. So yeah, like actually I don't have that video, and it was supposed to go ahead and say that the Nifty deal, which is $299, but I already said it enough, I think. So if anybody does need to contact me, my personal email address is there at dr.v@aerosolassist.com. That phone number will take you to Elizabeth. She could go ahead and answer all your questions. If you contact the aerosolist.com, you could ask anything in terms of pricing, whatever it is you want. And Warner Blumenthal, again, he's the biomedical engineer. He'll answer anything in terms of, I guess, for the physical properties of it. And I could answer anything in terms of clinical practice.
Awesome. Dr. V, thank you so much for joining us and sharing that. And guys, I'll put in the comments section the Nifty deal, the landing page for the Nifty deal. So definitely take advantage of that. And again, he laid it out. We're always worried about how much everything costs, but he laid it out. It's like less than $1. Less than $1, right? Per
30
patient.
cents.
30 cents. Okay, come on, guys. 30 cents. But again, it's an amazing deal. And here's the thing. Just look at your face shield at the end of the day. Ask your hygienist at the end of the day, their face shield. And you know what? If you're worried about, okay, well, I don't know if I want to use it, I'm pretty sure your hygienist will be using it. And then if you're like me, you're always going to try to take one of their units and bring it over to you because you're doing like something that like an electrosurgeon working with laser or working on anterior teeth. So again, the investment is such a small investment, right? You should go to this before you're thinking about getting something even bigger, right? Because chances are this will do the job. So Dr. V, thank you so much for jumping on. Thank you so much for being a part of our community. And you guys probably seen him. He's got the pretty cool profile picture with the green glove, So again, reach out to him. Don't take my word for it. Reach out to him. He's a dentist just like you. He's in the group as well. Message him, ask him all the questions you have, and again, you want to implement this because things are different now. Aerosols matter now, okay? And so again, they mattered then, they matter now, especially. So take advantage of the Nifty deal. Dr. V, thank you so much for jumping on. I appreciate it.
Thank you so much. Likewise.
Guys, we'll see y'all later.